One of the things that has really become clear over the past couple of decades is the mind-body connection. We know that having depression or anxiety increases the risk of having a heart attack or having heart failure. And if you have heart failure or have had a heart attack and you become depressed, you are at much greater risk of having another heart attack, dying, or being rehospitalized. So we often refer to this as a bidirectional relationship, meaning that depression actually may increase the risk for heart disease, and that if you get it when you have heart disease, you're at higher risk. Now, we don't have any data to say that depression makes a woman at higher risk than depression makes a man at high risk. But what we do know is starting at puberty, women have twice the rate of depression. So we have twice the number of women who are at risk or have this risk factor in our population. And we know that women's outcomes after heart attack and bypass and the like are worse than men's already. So to a certain extent, it's sort of a double whammy with the depression and the higher risk at the start. We have data that particularly for younger women under age 60, that depression really is much, much more common than it is in men, and it increases their risk significantly more. And this actually may help explain why younger women who have heart attacks have a much higher risk of dying than men the same age, whereas the risk of a 70-year-old woman and man dying from a heart attack are about the same. We do not understand the relationship fully, and so far we have not found that treating depression with the tools that we have available today, the antidepressants and cognitive behavioral therapy and the like, counseling, reduces the risk of heart disease. And so our approach is to ask women if they've had an episode of depression in the past, and perhaps chalk that up as another cardiovascular risk that we need to take into consideration when we're deciding on how aggressively to treat their heart risk. The other takeaway is that in cardiac rehab programs and after a diagnosis of heart disease, we need to follow these individuals very closely, men and women, because if they develop depression, it puts them at significantly increased risk, not only because we think depression itself is a risk, but if you're depressed, you're far less likely to do the kinds of things, make the lifestyle changes like eating healthy and taking a walk that will keep your heart healthy. And so women have this more prevalent than men.